Heart attack versus anxiety attack. 5 signs you must know. Your heart slams against your ribs, sweat soaks your shirt, and a clawing pain grips your chest. That terrifying thought screams in your head. Am I dying? It's a moment of pure panic where every second feels like an hour and your body is sending you alarm signals you just can't ignore. The good news? While both heart attacks and anxiety attacks can feel absolutely terrifying, they're very different beasts. I'm going to walk you through the 5 fastest ways to figure out if it's a heart attack or an anxiety attack. Because in that critical moment, knowing the difference isn't just helpful, it could literally save your life. We're talking about practical, actionable insights you can use right now. So, let's dive in. Section 1. Sign 1. The quality of the pain. All right, let's talk about the main event, the pain. When it comes to a heart attack, we're almost always talking about a crushing, heavy sensation. Think of an elephant deciding your chest is its favorite new armchair, or a giant vice slowly, relentlessly squeezing the life out of you. Patients often describe it as pressure, tightness, squeezing, or even a burning ache. This isn't usually a pinpoint pain. It's spread out across the center of your chest. And here's a big red flag. It can radiate. We're talking about pain that creeps into your jaw, travels down your left arm, or sometimes both arms, reaches into your back, neck, or even your upper belly. It's a stubborn kind of discomfort that just won't quit. Now, an anxiety attack, it hurts too. Sometimes intensely, but the pain often feels different. People frequently describe it as sharp, stabbing, or pin-like. Sometimes it's a burning sensation, numbness, a dull ache, or even an unusual muscle twitch or spasm right over your breastbone. Crucially, anxiety pain tends to stay localized. It doesn't typically spread to your arm or jaw like a heart attack would. If you can point to one specific spot with a single fingertip and that pain bounces or darts around, the odds tilt pretty heavily toward anxiety. But if it's that slow, spreading, unyielding vice grip, that's when your alarm bell should be ringing for your heart. Section 2. Sign 2. The trigger. This one's a real eye-opener. Heart attacks, more often than not, love a perfect storm of physical exertion. You're out there shoveling heavy snow, sprinting to catch the bus, or hauling a week's worth of groceries up 3 flights of stairs, when suddenly your heart's demand for blood outstrips its supply. It's a physical challenge that pushes your system beyond its limit. Anxiety attacks, on the other hand, are sneaky. They often ambush you when you're completely at rest. You could be sitting in traffic, mindlessly watching TV, or even waking up from a deep sleep, and bam, your brain inexplicably flips the fight or flight switch, flooding your body with adrenaline without any immediate threat. It's your internal alarm system going off when there's no actual fire. So ask yourself this: what was I doing 30 seconds before this started? If you were engaged in significant physical strain and then the chest pain hit, that's a strong indicator to call 911. If you were calm, relaxed, or even asleep and suddenly you're gripped by chest pain and other alarming symptoms, it still absolutely needs checking out to rule out anything serious. But in that scenario, it's more likely to be a panic attack. Remember, a heart attack is about blood flow blockage, often exacerbated by increased cardiac workload, while a panic attack is a physiological response to perceived danger, whether real or imagined. Section 3. Sign 3. The company it keeps. Neither a heart attack or an anxiety attack travels alone. They both bring a whole entourage of other symptoms, but the specific companions can tell you a lot. A heart attack often brings a posse that screams medical emergency. We're talking cold, clammy skin that feels like wet clay, a sudden onset of nausea or vomiting, and a ghost white pallor that makes onlookers gasp. You might also experience lightheadedness, dizziness, or profound, unusual fatigue. Some people even describe a feeling of impending doom, which can understandably overlap with anxiety. Anxiety attacks, while equally distressing, tend to bring a different set of companions. You might experience trembling, tingling fingers, or a strange tingling sensation around your mouth. A choking sensation or feeling like you can't get enough air is common, as is hyperventilation. And that overwhelming, terrifying feeling you're going crazy or losing control, that's classic anxiety. Sweat happens in both, but heart attack sweat is typically cold and clammy, often described as a cold sweat, sometimes smelling metallic. Anxiety sweat is usually warm and, well, more like gym socks. If you can still wiggle your fingers without tingling, or you notice your shirt is soaked but you're hot, not cold, anxiety is probably the louder alarm bell. Section 4. Sign 4. The clock. Time is a critical factor in distinguishing these two conditions. Heart attack pain doesn't usually hit like a lightning bolt and then vanish. Instead, it typically ramps up over several minutes, growing in intensity, and then stays stubbornly high. It might wax and wane a bit, giving you brief moments of false hope, but it never completely clears. It's persistent, often lasting for more than a few minutes or going away and coming back. The longer it goes on, the more serious the situation is. Anxiety attacks, including panic attacks, are often like a fast-burning fuse. They rocket to their peak intensity within a relatively short period, usually 2 to 5 minutes, and then typically begin to fade within 20 to 30 minutes, leaving you utterly exhausted but eventually breathing normally again. The symptoms might be intense, but their duration is generally much shorter than a heart attack. So check your watch. If you can still tell yourself it's getting better after 15 minutes, you're probably dealing with panic. But if 5 minutes in you feel worse, the pain is intensifying, and just talking makes you breathless, that's your cue to call EMS immediately. Don't wait around hoping it will magically disappear. Section 5. Sign 5. The relief test. Here's a simple yet powerful potential differentiator. Your breath. A simple breathing drill. Inhale slowly for 4 seconds, hold for a moment, then exhale slowly for 6 seconds will often blunt anxiety symptoms in under a minute. Why? Because deep, slow breathing helps to hijack your vagus nerve, which is a major player in your autonomic nervous system. It tells your brain, hey, everything's okay, stand down, fight or flight. This action helps to activate your parasympathetic nervous system, bringing down your heart rate and reducing those stress hormones. It's like hitting the reset button on your body's alarm system. Heart attack pain, unfortunately, is a much tougher customer. It ignores breathing tricks, cough maneuvers, or even sipping water. Your heart muscle is literally being deprived of oxygen, and no amount of deep breathing is going to fix a blocked artery. So if you try controlled breathing for a minute or two and there's no noticeable change, or if your symptoms continue to worsen, that's a clear sign that you need immediate medical attention. No change after 2 minutes of slow, deliberate breathing, time to activate 911. If these distinctions are already clearing the fog for you and you're feeling a little more empowered, do me a huge favor. Hit that like button. Seriously, your click helps YouTube show this video to someone who might be scrolling tonight, mid-panic, searching for answers. Your simple click could be the difference between a panicked call and a life-saving one. Let's make sure this information reaches those who need it most. Section 6. The overlap zone. Now, let's get real. The human body is complex, and sometimes the lines blur. Yes, both heart attacks and anxiety attacks can cause dizziness, palpitations, and that dreaded "I'm about to die" feeling. And here's where it gets even trickier. Not everyone gets the classic Hollywood heart attack symptoms. Women, for example, are more likely to experience atypical symptoms like unusual fatigue, shortness of breath, nausea, vomiting, or pain in the shoulder, upper back, neck, or jaw, sometimes even without chest pain. Diabetics often have silent heart attacks, experiencing minimal or no chest pain due to nerve damage and instead presenting with fatigue, shortness of breath, or nausea. Older adults, especially those over 75, might just feel generally unwell, confused, or weak rather than having specific chest pain. This is why the golden rule exists, and it's one you absolutely must ingrain in your mind. When in doubt, get it checked out. Paramedics would honestly rather haul 100 false alarms than miss one fatal occlusion. Never, ever hesitate to call 911 if you are unsure. As medical professionals often say, it's better to be told it's anxiety than to stay home when it's your heart. Your life is far too valuable to take that gamble. Section 8. Can anxiety damage your heart? This is a question many people ask, and it's a good one. A single, isolated panic attack, while terrifying, will not directly clog an artery or cause a heart attack. A heart attack is caused by a blockage in a coronary artery, not a sudden surge of fear. However, let's be clear. Chronic, untreated anxiety is a different story. Think of your body's fight or flight response as a powerful but temporary surge. When anxiety becomes chronic, this system is constantly on high alert. This means prolonged exposure to stress hormones like cortisol and adrenaline. What does that do? It keeps your blood pressure elevated, increases your heart rate, and can even contribute to chronic inflammation in your body. Over time, these physiological changes can damage blood vessels, promote plaque buildup or atherosclerosis, and strain your heart muscle. Beyond the direct physiological effects, chronic anxiety can also nudge people toward unhealthy lifestyle choices. It can make you more likely to smoke, lead to insomnia and poor sleep, or trigger junk food binges, all of which are real, well-established risk factors for coronary artery disease and other heart conditions. So while anxiety doesn't cause a heart attack in the way that a clot does, it absolutely contributes to a hostile environment for your heart. If panic strikes weekly, or if anxiety is a constant companion, please see your doctor for therapy, medication, or both. Your heart and your overall well-being will thank you decades from now. Okay, so if you or someone you're with experiences chest pain and you're a little bit worried, here's your immediate fast action plan. Every second counts, so commit this to memory. 1. Stop everything, sit down, and note the time. Get off your feet, find a comfortable position, and immediately check the clock. Knowing the onset time and duration is crucial information for medical professionals. 2. Chew one 325 milligram aspirin if you have it and aren't allergic. If you're not allergic and have aspirin readily available, chew a full strength 325 milligram aspirin. This can help thin your blood and improve blood flow to the heart, potentially reducing damage during a heart attack. Only do this if you're sure you're not allergic and ideally after speaking with a 911 operator. 3. Try the breathing drill once. Inhale for 4 seconds, hold, exhale for 6 seconds. Do this for a minute or two. If it helps calm you and eases the symptoms, it points towards anxiety. If there's no change or things worsen, assume it's your heart. 4. Call 911, don't drive yourself. This is non-negotiable. If the pain radiates, you feel cold and clammy, you're nauseous, dizzy, lightheaded, or the breathing drill doesn't help, call 911 immediately. Emergency medical services, EMS, personnel can start life-saving treatment on the way to the hospital, and they're trained to handle cardiac emergencies. You get faster, better care by ambulance. 5. Unlock your door. If you're alone, unlock your front door so EMS can get in quickly when they arrive. Every second matters. 6. Tell someone nearby, never ride out chest pain alone. If anyone is with you, tell them what's happening. Don't try to tough it out. If you're alone, call a trusted friend or family member after calling 911 so they know what's going on and can potentially assist. Conclusion. So let's wrap this up with the core takeaways. Crushing, spreading, persistent pain, especially with cold sweat, nausea, or radiating to your arm or jaw, that screams heart attack until a doctor proves otherwise. Sharp, localized, fast-fading pain, often accompanied by trembling, tingling, or a feeling of losing control, that leans heavily towards anxiety until a doctor says otherwise. Either way, the right call is the one that keeps you alive. It's always better to be safe than sorry. Don't second guess yourself when your body is sending you urgent signals. Share this video with the person who texts you at 2 a.m. wondering if they should go to the ER. This information could be the clarity they desperately need. Subscribe and ring the bell so you'll never miss the next 2-minute first aid lesson that could make all the difference. Stay safe, stay curious, and may your next heartbeat be a calm one.